Welcome back to Thrani. I'm Joe B. Say goodbye to lateral leg and foot pain through myofascial cupping of the Fibularis Longus and Brevis muscles. Let's dive in. The fibularis or peroneus longus muscle originates from the head of the fibula, the proximal 2/3 of the lateral surface of the fibula, and the intermuscular septa. It inserts at the medial cuneiform and first metatarsal bone. It is innervated by the L5 to S1 superficial fibular nerve, while it receives its blood supply from the fibular artery. It is responsible for foot eversion, plantar flexion, and lateral arch support. On the other hand, the Fibularis or Peroneus Brevis originates from the distal lateral surface of the fibula and inner muscular septum. It inserts at the tuberosity of the fifth metatarsal bone and has the same action and innervation as the Fibularis longus. It receives blood supply from the anterior tibial artery. Sudden, repetitive ramp-up with your running and walking activity can result to a strain or chronic inflammation of this muscle. Repetitive running or walking on uneven surfaces and having high arches can also cause it. This can lead to an upper and lower lateral leg or ankle dull aching, sometimes cramping pain with tightness. There can also be swelling and warmth on the side of the leg to the ankle. In addition to the symptoms presented, the assessment to determine Peroneus longus or brevis likely benefit from myofascial cupping will be the presence of allodynia or a painful response to a non-painful pressure stimulus. First, palpate the fibular head, then go 3 finger breaths inferiorly to arrive at the Fibularis longus muscle belly. Any significant tenderness as compared to the opposite side muscle should confirm it. Then continue to palpate up to the lateral malleolus to determine any allodynia coming from the Peroneus brevis. You have 3 types of cupping. Dynamic cupping, where you use silicone cups. You have static cupping, where you use plastic cups. And you have fire cupping, where you use glass cups. For today's session, we will be using silicone cups, in which case we will be providing dynamic cupping for the peroneals or the fibularis. You have different sizes for the cups, and for today, we'll be using the 1.8 inches in diameter cups. You have 2.9 inches in diameter, 2.4 inches in diameter, and 1.8 inches in diameter. To attach the cups to the skin, lay the cup onto the desired position, then use your thumbs to press down and provide suction. Before treating, wash your hands and make sure that you included the myofascial cupping intervention in your physical therapy plan of care to be signed by the referring doctor. Also, determine any presence of grapeseed or fractionated coconut oil allergy or silicone allergy, as this will not allow you to perform the treatment. The patient will be in side lying with the right lower extremity to be treated uppermost. The therapist will be on that side. Use the fibular head as landmark and palpate that first. Once identified, apply the grapeseed or fractionated coconut oil until there is noticeable glistening of the skin. Then use a silicone cup of 1.8 inches in diameter and place it below the fibular head. From there, you can use a diagonal pattern from the fibular head to the lateral malleolus, then progress it to a vertical pattern. Then finally to a pull and lift pattern where you use 2 cups instead of 1, which are placed at the midpoint between the fibular head and lateral malleolus. All of these cupping techniques are done for 5 reps, from the first landmark to the second landmark. And eventually you can progress to static cupping, where you can place cups 1 finger breadth of space in between for 10 minutes. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Thrani.